Welcome to another episode of the NEI podcast. I'm Dr. Sabrina Siegel, live at the NEI Congress 2022. In this extended Q&A episode, we take some time to sit down with one of our incredible speakers and allow the audience a chance to have their unanswered questions addressed from selected presentations. In this special episode, we're on site at the beautiful Broadmoor Resort in Colorado Springs. In this episode of the NEI podcast, I have here with me today Dr. Napoleon Higgins, who just finished his incredible presentation. We just got off stage. His presentation was titled To the Moon and Back, Pediatric ADHD. Welcome, Dr. Higgins.
Well, thank you so much for having me. We had a great time at the session this morning.
Yes, we did. Bright and early, too. We have some questions that you didn't have a chance to answer because we just had so many great questions and we ran out of time. So let me start with the first one. Do you have any thoughts about the online ADHD diagnosis and treatment? What are your thoughts on that?
Online ADHD diagnosis and treatment, I would say what is more important, whether it's in person or online, is doing a complete evaluation. So being online does not give an excuse of not doing a complete evaluation, where I do recommend being able to see the individual, like through telemedicine. And you have to make sure that you're going through the differential diagnosis and doing a full psychiatric assessment, whether it's online or in person. Because it is possible to be in person and not do a full evaluation. Right. And it's possible to be online and not do a full evaluation. But if you're not doing the full evaluation, you should not be making any psychiatric diagnosis at all. Yeah. Now, realizing that we do have rating scales, and rating scales can be very helpful online. Be able to suggest a diagnosis, but rating scales do not rule out other things that may be contributing to the issues that we see with inattentiveness and hyperactivity.
Right. That's a great answer. The next question is, are there any studies looking at an association between pediatric ADHD and the risk of developing methamphetamine use disorder as an adult?
So that is a common question. Realizing that these medications do have the possibility, be it very small, of causing addiction. But the other side of that is when you don't treat ADHD, you're more likely to have issues with addiction, simply because you tend to have difficulties in school, having difficulties academically, having difficulties at home. And if you're disrupting the classroom or if you're struggling in the classroom, you often end up in classes or individuals or even possibly alternative school where your social environment is people who struggle. And those who struggle with focus and attention issues often end up having more difficult lives. And sadly, you're more likely to end up with issues of drug use. So oddly enough, so even though these are stimulants and they do have that slight risk, you're less likely to get the risk if you actually are treating the individual and the patient. Also, understand this. I rarely find a person who is taking these medications who actually enjoys taking the medication. It's like, as a child enjoying putting on glasses every day so you can see in class. Right. Now, I wear my glasses every day, not because I'm addicted to glasses. I wear my glasses every day so that I can see and be safe on the road and be able to accomplish the things that I need to do in life. It is very rare for me to see a child who wakes up in the morning asking their mom for their medication. That is something that just does not occur. But if you do see these issues or something that is causing you question, especially as they get more into adolescence, you're looking at issues of diversion or the issue of you're running out of your medication early. All right. Now we're looking at maybe we may have something else that we need to work on clinically that may be the issue of drug use. So the fact is that you're less likely to use, and what you're taking is not enjoyable because it's only a small controlled amount. Understanding that the effect of these ADHD medications is minuscule in comparison to the effect of methamphetamine, which is designed to override all mental and brain systems, causing a huge reward. And you find that the doses that we give these medications in do not normally lead to a reward so far as causing you to want to take more medication.
Right. Wow, that's such a great answer. Thank you. What assessment tools do you use, and do you use a computerized assessment?
So what assessment tools are used? Normally I do the ADHD rating scales. Now you do have other, other scales like TOVA and whatnot that are online, those tend to cost money, and you can actually bill for those. All right. So I have done some of that. Also, I tend to like to use, the Connor the short Connors. Now, myself being a former teacher, I did not like filling out paperwork all day. All right. So I found that with me personally, as a former teacher, the shorter the form, the more likely it is to be accurately filled out. If you give me something and I've got to do 5 pages in another 20 minutes, so far as I get home to my family 20 minutes later because I'm filling out paperwork and I've got to do this every day or once a week, chance of it being accurate starts to drop.
Right.
So understand that, that patients are not research subjects where you don't necessarily always have that type of time. Mm-hmm. So you want to make sure that, you're getting information, and it's very helpful to get that information both from the patient as well as the family and from the school to make sure that, all of those individuals have access, through rating scales to give you more information, to not only make the diagnosis, but also to follow improvement over time on the medication as well. So rating scales, online rating scales, paper rating scales, or whatever information that you can receive is always going to be a positive in making the diagnosis and improving outcomes.
That's great. That's great. The next question is, what is the current stance on stimulant, quote unquote, holidays in pediatrics? Can you talk about that?
The current stance, I would say that my current stance on pediatric holidays, on holidays with pediatric patients on stimulants, has a lot to deal with the individual patient.
Okay.
All right. So I tend not to stand in a situation where, one, I prefer you to take your medication because ADHD and focus is not only good for academia, but it's also social situations. I can think of a family member who does not like to give their kid their medication. And so when they come over my house for July 4th, your kid is a problem at my house, and you're saying to yourself, your kid doesn't need to be on medication when your child is not actually in school, but now your child is at my house being dangerous or tearing up my home. All right. Then also socially, with children, so far as, well, they only have a game today. Well, you're forgetting the play. All right. You're supposed to set up on this side of the court and you're forgetting where you're supposed to be. Mm-hmm. Or we all are supposed to go on 3, but you went on 2, or we were supposed to go on 3 and you weren't listening because you were distracted. Right. Well, that starts to affect your play. And then also butting into conversations, not being able to follow along with what is going on inside the room. That happens outside of school as well. Right. So you have to consider that, but also you may have a child who's having a lot of side effects to the medication. So far as maybe they're not eating or they're not sleeping well, and this is giving them a chance to have a break. And then, of course, you can look at other options, other medications, but sometimes you've gone through 3, 4, 5, or 6 options. This one is one that works the best for that individual, but at the same time, they may possibly need a break for their appetite to rebound or to increase weight and things of that sort. Mm-hmm. So I always say that is very individual. My normal recommendation, I want you to be on something that you could take every day that's going to be tolerable, but then also we have these other issues that can occur as well. Now, when you're looking at your non-stimulant medications that require buildup over time, those need to be taken every day, all right? Because if you're missing 2 or 3 days out of the week of that medication, that's 2 or 3 days where it's not actually being effective and you're decreasing overall outcomes of those medications. So it depends on the individual, it depends on the medication, and a whole host of things on making that decision. But typically, I'm preferring that the child be able to be on a medication that they can take daily.
Right. Okay. Wow. That was a great answer. Can you speak to combining a stimulant with clonidine or guanfacine?
Combining a stimulant with clonidine or guanfacine. Now, I would say I typically do that so far as when either or is not working well enough. So if the stimulant is covering all the symptoms, no need to add clonidine or guanfacine. If I'm using clonidine or guanfacine extended release and it's covering all the symptoms, I don't need to add a stimulant. But the fact is that so often we may be limited on going up on the dose because of side effects. So we can only take this medication so far. We tried different medications, different classes, different delivery systems, and we're still not able to get the dose up high enough. So now I may use much of this, but maybe adding in a little bit of that is also what I need. So being able to combine the two many times can improve outcomes for a lot of children.
That's excellent. Can you speak to the decision making between the different agents regarding their different mixtures of L versus D isomers, and if those compounds might address the various symptoms of ADHD differently, such as hyperactivity versus inattention? Wow, that was a big question.
Yes. So you're looking at the D and the L isomers, which are mirror images. It's thought that the D isomer tends to be the more active isomer.
Okay.
All right.
Okay.
So most medications are going to lean more towards the D isomer versus the L. Now, that is all completely total to the how it works is so individualized to every patient.
Gotcha.
And that even though the L isomer is not as active, it does compete for the receptor, which it may knock the D isomer off, but then the D isomer has the opportunity to come back on.
Okay.
So you have, not only you have the amphetamines competing for locking onto the norepinephrine dopamine transporter,
right.
but you have a lot of combination of competing for those same receptors along with the regular monoamines and trace amines as well. So a lot of times it's the combination of all of that,
right.
and it's almost impossible to tease out for that individual which one is going to work best.
Right.
So I
Okay.
wouldn't include one in or include one out based upon that, but you do have to test the medication in the individual. And I wish we were further along in medicine than that.
Yeah.
But some of it is really trial and error, trying to individualize the treatment for the individual patient.
The next question I have for you is, how can we help our children with ADHD at homes when it comes to aggression associated with taking away phones or games, given that they're already on medication, but we want to help with the behaviors too? And I know you touched on this a little bit in your talk already, but can you expand just a little bit on that?
Well, understanding that, especially for a kid with ADHD, they have problems with inattention. Then when you enjoy something, you tend to hyper-focus on things. And that's one thing that we don't pay attention to with ADHD.
Yeah.
Things that they enjoy, they tend to hyper-focus on.
Yeah.
And so this is one of the few things that gives me things that light my brain up. All right. So I feel very comfortable when I'm ducking and dodging on the game system. I'm very active on social media. I'm getting a lot of reward. And you're telling me that the bigger reward is doing my homework. All right. Of which something that I don't enjoy. But also for ADHD, I tell families, it's like trying to run in a pool. I'm having difficulty with focusing, and I'm doing something over here that I enjoy where I hyper-focus on that more so than what other people do. And now you want me to walk and run in a pool where I don't do it well and I don't enjoy it and I'm not good at it.
Right.
So a lot of anger can occur because you're disrupting the enjoyment of dopamine and what it's doing for the brain and locking you in to now I'm in a situation where my dopamine does not fire. It doesn't feel good. And actually it hurts to actually do that because it's such a struggle for me.
Right.
So it's important to make sure that we use that possibly to our advantage where, listen, you can get on your game, you can get on your phone, but I need for you to do your homework first. All right. So let's set up a schedule where you come home from school, you come home from volleyball practice, you take a shower, you eat a meal, you start your homework. And the sooner you get to your homework and start your homework or even do your homework before volleyball practice, when you get home, you can get to the game that stimulates your brain. All right.
Yeah.
So that is an important way to put those things in sequential order to help with focus and attention of getting and putting that part of the reward system
Right.
that if I do this right, get this done early, then I can get to my reward where dopamine is actually pushing me through those other activities as well.
Okay. Wow, that's brilliant.
I love that. I don't think I've ever said that before, but that
great.
sounds brilliant.
That's great.
Yeah, record that. I'm going to listen to that myself later.
The next question is, can you discuss the social emotional issues that face children, in particular elementary age, that come with delaying treatment?
The social and emotional issues of delaying treatment, realizing when you're dealing with a child, all they know is really school. That is the most important thing that they do. And when you struggle in school, especially your peers are doing well, but you're not doing well.
Right.
You're struggling along. You're not understanding the information. And you're sitting in the classroom confused while life is moving forward and you're being left behind. That is a very painful feeling to have, especially in the confusion of being young and understanding children do not have very good vocabularies. So they're not able to tell you what is wrong.
Right.
They're not able to say, I'm struggling in school because I'm not focusing and paying attention. I can't concentrate. I'm forgetting what the teacher is saying. They know that they're struggling and the world seems to be caving in on them. And that is a very painful sort to be in. It's like going to work and being constantly told that you're not good at your job and you don't know how to fix it. You're not receiving any feedback of what's going wrong. And you don't want to develop in a situation where school becomes a traumatic event. I don't want to go. I don't want to be involved. I'm not good at what I do. I'm constantly being fussed at. I'm not able to make it. And what will I do if I can't learn how to add, subtract? I still don't know my colors. Everyone seems to know around me and I'm struggling. You don't want to leave your child in that situation. You definitely want to make sure that you address it. Sometimes that's with medication, obviously, but also those other accommodations that come with school. So far as tutoring, you're trying to avoid remediation, but remediation services are sometimes going to summer school to get ahead in life, to pick the information up in a different situation. And realizing those school services help to catch you up, but many times those school services help you to surpass your student, your other peers in your class. So it's a combination of multiple things to make sure that we're addressing the needs of the individual child. And it's never too early to address a child's need. Yeah. That improves outcomes very much later throughout life. Understanding academics and having mastery of information is a huge emotional booster to that child.
Right. Could definitely see that. And also in building confidence, right?
Confidence.
Yeah.
When, and I always, when you mention confidence and building confidence in kids who are especially struggling in school, tutorials, summer school, oddly enough, kids who go to summer school actually leapfrog their peers. Summer school puts you ahead of your peers, and that gives you more confidence going into the next year, and that I actually understand and know the information. Early childhood education is very important. I tell a family this: if your child does not know how to read and write in kindergarten, that's because you did not teach that child at home. The reason we wait until 5 years old to go to kindergarten has to do with potty training children. Yeah. The child can go to the restroom on their own, and that's not one thing that we got to work on in the classroom. But you actually can teach a 3-year-old to read. They can understand colors and numbers and letters and words and things of that sort, and you do not have to wait. So when that kid walks into kindergarten and they already understand that information, that's a huge booster. If a kid is ADHD or not, but if they are struggling and we've identified that, making that intervention early improves confidence throughout the rest of their education.
So that takes me to my next question, which is, if a child is doing very well on a stimulant but develops a tic, do you stop the stimulant or do you add an alpha agonist?
So a child is doing very well on a stimulant, develops a tic. Do you stop the stimulant or do you continue the stimulant and add an alpha agonist? Well, I would say that when you look at alpha agonists and their ability to treat tic disorders, there's limited information that shows that it actually adequately treats the tic disorder. But it can be an advantage to be able to add it if a child has had a tic disorder on the stimulant. One, you have the option of going with the alpha-2 agonist all by itself, stopping the stimulant and decreasing the tic. Or more often than not, if the stimulant was working very well, I will decrease the stimulant itself and add the alpha-2 agonist on as well. All right. Now, realizing that tics come and go. You tend to only see an issue with tics in someone who is predisposed for having tics. And if you do a further history, sometimes the family will notice that they do blink their eyes excessively, or they do make a little bit of a noise or something like that we really didn't pick up until that stimulant drew it out as we increased the dose. So sometimes you can back down on the stimulant, sometimes not completely eliminating it, but adding the alpha agonist on. And then you also have the option of other non-stimulants, realizing their effect size is not as great, but they can be very helpful and work as well depending on the individual patient. So you do have your multiple options. I've also found that going with a medication that releases a little bit slower into the system, where you're not as much as going in at one time, maybe I can, actually activate dopamine without pushing the motor functions out as well with that. Gotcha. So there are a lot of ways to tease that in. But some kids cannot tolerate the stimulant and tics will run wild on the medication. And at that point, you may have to treat a tic disorder.
Okay.
All right.
Okay.
Which is a different way of, treating dopamine inside of the brain. You're blocking dopamine in a different way on the postsynaptic receptor.
Right.
So there are multiple ways to do this, and you have multiple options, and sometimes you've just got to work your way through it. It is important to make sure you give reassurance to the family and to the child of what you're doing so they're not losing hope, but at the same time knowing that it may take a little bit of time for us to figure all of this out.
Okay. And that takes me to our final question, which is, do you think there's any neurobiological link between development of ADHD and trauma?
The neurobiological link of developing ADHD and trauma, realizing that trauma is one of the most misdiagnosed and underrecognized issues that we see in children.
Right.
And the problem is that many times for a child, especially the younger the child, the less they clearly understand what trauma is. All right. As an adult, we recognize trauma. That was a traumatic event. That wasn't supposed to happen. As a child, trauma is your lived experience. It is what you know.
Right.
Be it physical trauma or sexual trauma, this is what I know of life. And so because it's such a lived experience, the younger you are that it occurs as your brain is developing, the more difficult the outcomes and the ability to reverse that actual issue becomes. So when we look at the issues of trauma, it actually uses dopamine, all right? It causes anxiety issues, and also it affects the amygdala, which is where your emotional and instinctual center are, the hippocampus, which, controls memory, and then the prefrontal cortex, where you have dopamine. So this is an entire system that can be disrupted, not to mention if you're having flashbacks, if you're having issues with sleeping at night. All of that causes problems with focus and attention inside of the classroom, which is very difficult to tease out if you already do have ADHD as well. And then many times you're dealing with a combination, and it's hard to know if the trauma is causing the issues of focus and attention, or if you have an independent diagnosis of ADHD on its own. And a lot of this will unfold over time, and don't kick yourself on day one if you haven't figured it out.
Okay.
So the important thing is, if a kid is having issues with trauma, address the trauma. The main thing you have to do is address safety, because many times the child is still being traumatized while they're seeing you. Trying to make sure that you separate them from the continual trauma, give them an understanding of the trauma and the issue of recovery. But the memory issues of what occurred can impact and be impairing and cause difficulties with focus and attention inside of the classroom.
Right.
All right. So we always have to screen for that. So if I'm being sexually traumatized every night and then I have to come into the classroom and sit, you never know what a child is going through, or the mom and dad are fighting, or I'm living in a home with a single mom and mom works at night and I'm always worried because I'm afraid to fall asleep by myself. Or the issue of mom didn't come home again last night because of her own particular issues of drug use, or dad is very angry and I'm hearing the yelling and everything even while I'm sitting inside the classroom. So there are two, they could be combined, they could be both independent, but they both may have to be addressed at the same time. Realizing that the stimulant may make the trauma worse. So I'm already having issues with nightmares and flashbacks, and now I'm taking a stimulant that is keeping me up at night. All right? But then the other side of that, the alpha-2 agonists sometimes have shown to help decrease symptoms of trauma, all right? Even in older adults. So that could be helpful in helping a person calm the trauma down, helping them focus and pay attention and being able to sleep. Now, so all of these medications can make it worse or make it better, making sure that you're making the adequate interventions, and that medication can be helpful, but there's a lot more things that you need to address inside with that kid outside of which stimulant that you're going to pick.
Right. Absolutely. I love that. And on that note, I will say thank you so much for sharing all of this incredible information, both in your presentation and in this podcast episode as well. Thank you all for tuning into this episode. And thank you, Dr. Higgins, for being on our show.
It's been great. Thank you so much for having me.
Thank you so much for joining us for another episode of the NEI podcast. Please let us know what you'd like to hear more about by leaving a review. Don't miss another episode. Subscribe today.